I'll start again then. There we go. Got the microphone going. Mainly for all the hordes of people watching online. Welcome to the Health and Wellbeing Board. I normally go around the room and ask everybody to introduce themselves, but I think everybody here in the room and online pretty much knows everybody, having been in previous meetings together. So I won't go around and ask to do introductions. But first off, I'll just ask our Democratic Support Officer to read the housekeeping notes.
Thank you, Chair. Please note that this meeting is being recorded by the Council for live broadcast and will be published on the Council's website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public, although ultimate discretion in this matter lies with the Chair in case of disruption. For those in the room, please note that if the fire alarm sounds, please exit the building by way of your nearest available signed fire exit route and make your way to the assembly point at the War Memorial in the gardens opposite the front of the building in Bourne Avenue. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. For those in the room, this includes turning off microphones and turning the volume down completely on laptops. Thank you.
Thank you for that, Sinead. Sorry, Sinead's our sort of substitute clerk for the meeting today. Unfortunately, Louise, our normal Democratic Support Officer, is poorly at the moment, and Claire, the substitute, is also not well. So, unfortunately, that's it's the way of the world at the moment, isn't it? Lots of people with respiratory illnesses, but maybe it's something we can do something about. Right, okay, if I can just now move on to the agenda items. So firstly, apologies. If you can confirm any apologies for this meeting.
Thank you, Chair. We've received apologies from Graham Farrant, Glyn Barton, Matthew Barrant, Dawn Dawson, Mark House, Karen Lotus and Heather Dixie.
All right. Yeah, so Siobhan Harrington and then substitute. So Richard Renault is substituting for Siobhan. And any other substitutes that we've had reported?
No, we haven't had any other substitutes.
Right. Great. Wendy.
Yeah, so Wendy Lane, I'm substituting for Glyn Barton.
Right, okay. Thanks, Wendy. So we've got 2 substitutes. I was then going to just have to quote the from our terms of reference about a quorum, but actually, Richard, as you've come into the room, our quorum is, you saved the day there. Our quorum is 7 members of the Health and Wellbeing Board, and it has to be at least 1 representative from the NHS. So, Richard, welcome. You're very welcome this afternoon, so we can actually make decisions. So we are, I'm pleased to report, as far as I'm aware, we are now quorate. Okay, if you have to move your car in the car park at the point we need to make a decision, we will have to make an executive decision about waiving your car park fine if you get one. Okay, agenda item 3, the declarations of interest. Anybody got any declarations of pecuniary interest? If there's anything that arises during the meeting that you feel you need to declare, then please feel free to do so as we go along. Item 4, public issues. We had any public issues?
No, we haven't received any public issues. Thank you, Chair.
Right, okay, so no public statements or questions. Okay, agenda item 5, to receive a presentation informing the board of the work of the Community Action Network. Unfortunately, had a message from Karen Loftus, who's obviously sent her apologies, had a message late last night that she's not well, so she'll be unable to come along today to present, to give that presentation. I think it's been sent out separately and was advised that if there are any questions on the report, then those can be emailed to Karen. But other than that, the suggestion is to defer this item to the next meeting. So are members happy that we defer this item to the next meeting in March? Is that okay? Everybody nodding? Good. Okay, so we'll agree to defer the presentation from Community Action Network until the March Health and Wellbeing Board meeting. So, agenda item 6, the BCP Safeguarding Adults Board Annual Report for 2023 to 2024. And we have Sian Walker as the chair of the Safeguarding Adults Board online for us. So if you'd like to go ahead and present the item.
Thank you very much, Councillor Brown. I have actually presented this annual report in some detail at Scrutiny Committee with a full presentation and was advised of only a couple of minutes today, so decided to not use a presentation. You will have all read the annual report. You will see that it's the one of the 3 statutory duties that the Safeguarding Adult Board has to present to the Council's Health and Wellbeing Board every year. And before doing that and in producing our annual report, we consult with Health Watch over the summer before the board approves the report itself in September. So this is a report reflecting the year up to March 2024. So we're nearly to March 25, so it's quite a way off. I would say that there's nothing particularly unusual that we've unearthed in looking back at the data in looking at our performance over this last year. The data page in the annual report is as I would expect it to be, and indeed we note from BCP Council Adult Social Care collects the data on behalf of the board because Adult Social Care is the lead agency. And we note that there's a 20% decrease in concerns from the previous year. And that's not a bad thing. It's because there's been some intensive work undertaken by BCP Council with partners across the board in better understanding the criteria for referral for a safeguarding adult concern. Members will appreciate that with children, it's much easier safeguarding children because everyone under the age of 18 is a child. With adults, it's much more complex because it's about that adult's ability to make decisions for themselves. And safeguarding adults connects with those adults who have care and support needs and because of those care and support needs have been unable to protect themselves from abuse, neglect or harm. So we've had good attendance with the board over the last year. We've delivered a lot of that in our 3-year strategic plan. We deliberately have a strategic plan for 3 years rather than 1 so that we can slip items into the following year and we can bring items forward where we feel that the data and evidence from audit is showing us that we need to concentrate on a particular area. With that in mind, one area that we know the highest number of concerns are received in BCP Council, but also across the country, is in neglect and self-neglect. And so our quality assurance subgroup is regularly looking at audit and in assuring itself so it can assure the board that all partners are doing everything they can to prevent and to work with partners around self-neglect. We've done a lot of work this year with our community engagement subgroup, a group which has representatives from the voluntary and community sector, as well as those people who through that sector have used safeguarding services or had safeguarding interventions. And one of our key areas is to promote a better understanding of safeguarding, to promote what people need to do to act early in the preventative stage before issues become so serious. We published a Safeguarding Adult Review, SAR-Billy, during the year, and most of the actions around SAR-Billy have been delivered. When we publish a serious case review or a safeguarding adult review, we don't just do the work and shelve it. We continue to look at it a year on, say, would it still happen again here? And we will be looking at SAR-Billy again in our annual safeguarding adult review reflection event, which happens in Q1 of the next financial year. I've nothing more to add at the moment, but happy to answer questions. Thank you.
Thank you, Sian, for that sort of run through. I think the time you spend running through there is sort of completely disproportionate to the amount of work that goes on behind the scenes in terms of safeguarding adults and the detail of the report that that the board has prepared and that's been submitted. Any questions from any colleagues? Betty?
Which one?
That was strange.
I thought it was on this.
But again, is that the right one? Can you hear me okay? Yeah, okay. Thanks, Shan. Shan, thank you. I just wanted to pick up on one or two things because this is a really, really detailed report and there is so much information in there. One of the things I wanted to just remind the board of was that a little while ago when we last presented, when Shan and colleagues from BCP Council presented to overview scrutiny and various other boards, it was requested that we separated the annual reports, and because before it was a joint one, so Shan has kindly done that, and that's why there's so much detail. It's very specific. It's important to still look across because we are a Dorset wide adult board, but important to just note that that's been done, and I can see the chair of our overview and scrutiny is present as well, and that was a request that also was kind of requested from that board as well. Also, just wanted to just to let the board know as well that Shan, as our chair of the board, her contract would expire in April, and the executive members of the board have asked Shan if she would kindly consider continuing to remain as the chair of the Dorset and BCP Council and other partner safeguarding adult board, and Shan has kindly done that. So a further 2 years extension or renewal of Shan's contract from April with a further option of a further year after that. So we're delighted about that, and we'd just like to thank Shan for agreeing to continue to be the chair of our board, because some excellent work is taking place. And please do, if you haven't had time to really digest the report, please do find some time to look at it, because there's so much information in there and it paints the whole picture of all of the work that the teams and partners have been doing over the last year. So thank you, Chair.
Thank you. Councillor Moore, did you want to?
Yes, thank you, Chair. Yeah, well, as you know, I'm new to this board, but I have seen and read safeguarding board reports before. And can I just say how impressed I was by the way that this report was written, the format, and particularly I like the board members report where you had the list of the achievements and also what the challenges had been and the future plans. And I just thought the whole thing was just made everything so clear. It was really easy to read. And it made it all very, very interesting, you know. And it was a report that I actually read it twice because I thought I might have missed something the first time because it was actually so good. And I don't say that very often about reports that I read, but this one was really, really good. And yeah, I thought, yeah, well done. Thank you.
Thank you, Sandra. Shan, did you want to respond?
If I may, just to respond to that, and thank you very much for your compliments. My mission in life is to make the complex simple, because I think if we make our documents really easy to understand, and it includes everybody, and it removes any myths that exist, and it's all part of our board communication plan. So I appreciate that that's been picked up, and thank you very much.
Thank you, Shan. Any other comments from any other board members? I know a few of us attend the Safeguarding Adult Board meetings. A few of us have seen the report presented in other forums as well. So there's no other comments or questions. I'd like to add to actually what Councillor Moore said. I think certainly the section of the report that focuses on the achievements that lists for the board, and also all the various partners listing their achievements in the year in the annual report, is really valuable to show the sort of amount of work, not just by the board, but actually by all of its partners that constitute the board. So, okay, I think it's then the decision is just for us to note the report. Unless there's any other comments that people wanted to add, I just wanted to thank you, Shan, and the whole Safeguarding Adults Board for their work through that year and the ongoing work now and for future years. So I'm pleased to hear, that you'll be around for a couple of years more. So.
Thank you, and we appreciate, Councillor Brown, that you regularly attend and are there with us at board meetings. Thank you.
Yeah. I particularly welcome when you have them in my ward at the Cobhams Sports and Social Club in Merley. I can almost cycle there sometimes.
That's good.
Thanks. Right, so we've noted the report. I think unless there's any other comments, we can move on to the next agenda item. So,
thank you, and I wish you well.
Thank you. Agenda item 7, the Joint Strategic Needs Assessment, the JSNA update. And I think we have Natasha Morris online from Public Health Dorset to present the item. So if I can ask you to come off mute and present it. Thank you.
Thank you, Chair. Good afternoon, everyone. I'm Natasha Morris. I'm the team leader of intelligence at Public Health Dorset, and I just wanted to provide an update today on the Joint Strategic Needs Assessment Work Programme, which is currently focused on developing a children and young people specific assessment. The JSNA is a statutory process of identifying current and future health and social care needs in our local area, and assessment should take consideration of the wider factors that impact on health and wellbeing. It considers a range of quantitative and qualitative evidence. The current process is coordinated by Public Health Dorset on behalf of both BCP and Dorset Health and Wellbeing boards. The usual process is that we produce annual narratives and have some more focused assessments throughout the year as and when required. The latest topic that was requested and that's been in development is for children and young people. So I've been working over the last little while on a number of scoping sessions to speak to key stakeholders and help to scope what should be in the assessment and what are the key questions that everyone would like to be addressed. The results of those scoping sessions are 4 key questions that the assessment is going to aim to provide evidence to answer. Those are what are the key trends in health and wellbeing needs that are affecting our children, young people and their families? Where are the areas of need? So that might be specific cohorts and communities, or it might be geographical variation. Also, part of the assessment is to include the views of local children, young people and their families from the wealth of engagement and research that's going on across BCP. And also, what are some of the positive health trends? So from the data, where have we seen positive movement in indicators? And also wanted to bring a strengths-based element to the assessment and identify the range and wealth of local assets that help to support our local children and their families. So hopefully I can share my screen. Bear with me 1 second while I find the right window for this. I wanted to bring attention to Appendix A in the document, which is sharing the proposed content. So I thought I'd just bring it up on screen so that we can all reference it. So this is the proposed structure for the assessment, which is based on helping to answer those key questions and also all of the valuable input and insights from conversations around the system on what should be in the assessment. Planning to group the content into 4 sections. The first 3 of which broadly align to the integrated care partnership strategy themes. So looking at thriving communities. So these are some of the what are called wider determinants of health. So thinking about income, housing, education, all of those important topics. The second area would be looking at healthy lives, which relates to the, I guess, more specific conditions that children and young people might be experiencing. And then the third section is around health and care. So that focus on the service point of view and how we work together as a theme from the Integrated Care Partnership. And from talking to people, we've added a fourth section, which is looking to the future, what's on the horizon, pulling that future element into the assessment as well as where we currently are. And hopefully, as you can see from this diagram, the topic of children and young people's health is quite broad. So I'm hoping that this suggested scope and structure will provide a comprehensive overview of the health and wellbeing issues that children and their families might experience. Welcome any thoughts or feedback into that as we're currently finalising the assessment, and just wanted to share my appreciation for colleagues from all of our organisations who've been very valuably inputting into this assessment as we're developing it. We're just filling in some further detail regarding children with special educational needs into the assessment, and once we've got that part finalised, we're hoping to publish the assessment by the end of this month. So just wanted to provide an update on progress to the board, and thank you very much for your time, and I welcome any comments or questions that the board might have.
Yep, thanks for that, Natasha. And we've obviously got the report and the paper in front of us as well. So any particular comments or questions? Kathy first.
Thank you, Natasha. That's very comprehensive. The subject matter across those four elements is huge. So I don't underestimate the amount of work that is going in to actually cover all those areas. So really welcome this, and I know that you've been speaking to children's services as well in terms of those areas. Just thinking about we've been working on a children and young people's partnership plan for 2025, and just wanted to make sure that we dovetail some of those priorities, and so we're supporting this strategy and you're supporting the children and young people's partnership plan and making sure that we do that. That'd be really helpful. But well done, really pleased to see it. So thank you, Natasha.
Thank you, Kathy. And yes, I've been in touch with a couple of colleagues who are working on the partnership plan and continue to make sure that we dovetail the two.
Thank you.
Any other questions or comments for Natasha or points raised on this joint strategic needs assessment? Yep, Gillian, do you want to?
Thank you, Chair, and thank you, Natasha, for the presentation and for the paper. I wanted to ask on one of the specific points, what you might expect to be presenting and what will that the board might be interested in some future point. I think it's really useful that you've extracted a set of issues for things on the horizon, because it's too easy for us to just focus on the day-to-day and the issues that are already in front of us. But the fact that you're looking ahead to the potential of a smoke-free generation is something that feels really exciting in the potential of it. But can you say a bit more about what sort of detail and what sort of data we might expect to find sitting under the smoke-free generation, and how we might expect to track that over the months and years ahead? We hope to seeing a generation of young people who are much less likely to smoke than their predecessors. Thank you.
Thank you, Gillian. And yes, appreciate the feedback on the horizon scanning element. So within the assessment itself, I intend to include data on smoking and where the evidence is their vaping behaviours in children and young people, and on the horizon scanning part, encouraging the discussion and consideration of how the new smoke-free generation legislation and elements coming in will factor into the future of our children's health around smoking. We know smoking is one of the key areas within public health and health and wellbeing generally, and it's an important consideration to help promote this important legislation that will be coming through.
Thank you for that. Next, Betty, did you want to?
Yeah, so thank you again as well, just to echo the brilliant report. I just wondered, Natasha, have we looked at anything for the future horizon? And I know you will have done this around artificial intelligence and how that can really feed in and help us, particularly with improvements in health and health outcomes. I know today is, the Prime Minister launched where artificial intelligence might fit in for the country and what we might be looking at. And there was quite a lot of detail in that, what I've been able to scan around how it might help with health and improve health, improve the health of the nation. And I just wonder, are we making sure that we're factoring that in and using the information that's available to us to help really improve some of those outcomes? You focus just on smoke, smoking and cessation of that, within younger adults, and that artificial intelligence might be something that can really feed into helping with that around communication and around lots of other things. I'm just really interested to hear if that is on the horizon, and what, if anything, you're able to share. Thank you.
Thank you, Betty, and agree. I really wanted to include an element around digital wellbeing and AI in the horizon scanning, because it is a growing area, and there's potential benefits. I can't speak for what technology might be used. I can only speak for data, but I thought it would be an interesting consideration to put into the JSNA, and for that, starting that discussion piece really on how can we make use of these potential assets around artificial intelligence, and how it might help us with maybe apps or communications, or thinking about kind of really personalized interventions, and these kind of digital tools can help to support the development. So I think it's a really key and interesting area on the horizon.
Okay, thanks for that, Natasha. Any other questions or comments on the report? Sam, did you want to?
Just to come in on the AI and digital debate, my personal view is I think we probably need to look at digital wellbeing more holistically. First of all, it would be really interesting to follow the online safety bill and see where that ends up, and to see how that then translates through into healthier practices around digital use. We do use some AI within some of our services, but I'm also aware there are a lot of big companies out there with some big platforms looking to make some investments in that. So I think it's important to separate what Natasha's trying to do, which is to make sure that we've got access to the data to support some of these future trends. What we do in the service space is probably another conversation as that evolves over the next couple of years. But organisations like Live Well Dorset already do use a lot of digital wellbeing, health behaviour change, and AI is a part of that. But it's separate to the data that Nat's trying to capture under JSNA.
Thanks for that. Any other comments or points? Oh, yes. Patricia's online. Yeah, Patricia, if you want to come in.
Thanks, David. Thanks for the report, Natasha. It's not a question really, it's just a thought around what we do in the future, because I think if you look at the government's intention around the leftward shift and moving more into a space of prevention, how do we use the information in the JSNA and a lot of other intelligence that we've got to get on the front foot of that? And we're just in conversation with some colleagues outside of our system around how do we use the information in our Dorset Insight system, and maybe some of the biomarkers that are available through different companies to start thinking about disease prediction. So how do we bring some of that together with the JSNA so that we are in the majority not being on the end of responding instead of starting to get into that prevention space of understanding why certain things happen and then putting steps in place to prevent that, and particularly around Sam referred to the digital environment for young people, and also some of the issues we have got with our young people getting into negative or poor behaviours, and some of that being a linking into the work that and the outcome that came out of our ICP work around people not having a purpose to their day, and because we don't have the greatest employment opportunities in some areas, and then as a result of that, getting into some behaviours that are not particularly healthy.
Thanks for that, Patricia. Yeah, I think that's a useful point about context, isn't it? About shifting from the sort of responding to the sort of needs and actually, you know, the prevention, the whole prevention agenda, which we talk about and lots of our different forums talk about. So yeah, I think highlighting that that context is really useful. Any other points or comments? Oh, Gillian, if you wanted to come in.
Yes, thank you, Chair, for letting me come back in a second time. I just wanted to ask Natasha, having brought this to the board, if there's anything that the board can do to help you with the process. For example, are there any areas where you've got gaps in the data, whether that's quantitative or qualitative, that you think that partners around the table could help? It's a free opportunity to ask that or to follow up with us afterwards, because I'm sure we all want to help this to be the richest data set that it can be.
Thank you, Gillian. Really appreciate that offer. I've had lots of input from colleagues from the organisations around the room. So I think I've got most of the data we need for the assessment. And one of the things I'm putting in is to think about questions where we don't have the data or we might not have the answers. Perhaps that's a future conversation we could have either in the board or as part of our ongoing engagement around the JSNA, is thinking about where we do have some knowledge gaps or areas we might want to explore further. I'd be really keen to do that.
Okay, thanks for that. My comment on it actually was picking up on what a couple of others have said about the items listed on the horizon, which actually did make me think about things that you don't always sort of think about when. And I think it's important. Earlier in the report, it talks about the JSNA is about an assessment of the current and future health and social care needs of the local community. When often you're looking at these things and you're thinking, well, what are the needs? You know, the assessment of the current needs. But having that section, I think, about on the horizon very much makes clear that the whole agenda of it is looking at future needs as well, not just, well, what are the needs and how we're fulfilling those, but actually where are we going with all of these, and actually are our services and fit to deliver what's going to be coming down the track. So thanks for that. If there's no other comments, I think it's just recommended that the progress on the JSNA for children and young people has been noted. So if members are all happy to note for that, I think it's a useful point Gillian made about the Office of help or support in sort of getting the data together and helping to sort of to make that as sort of rich and useful. Is a welcome offer. So. Okay, everybody's nodding, so that's noted. Thank you very much, Natasha. We can move on to our next item, which is item 8, which is the Better Care Fund for 2024-2025 Quarter 2 report. This is the one where there is a recommendation that we have to make a retrospective approval of this. So if I can ask Scott, our commissioning manager, to come in.
Hi there, yeah, I'm just about to share my presentation just so everyone can see. Looks like it's going up, brilliant. Okay, hi, good afternoon everyone. I'm Scott Sathan, the Better Care Fund Manager for BCP Council, and I'll be presenting the Better Care Fund Q2 report. I wanted to bring a PowerPoint presentation to bring some life into the report and give the board a glimpse into how the Better Care Fund is being utilised. It was back in July 2024 that the Health and Wellbeing Board approved the original 24-25 plans, so I think now is a good time that we sort of reflect and see what's happened since then. So the report provides details on the expenditure of the schemes and the capacity and demand plans from April to 8 September 2024. We also reviewed the progress of the metric targets set in those plans, and these metrics include avoidable admissions, discharge to usual place of residence, falls, and residential admissions. This data was collected in partnership with our scheme leads, members of the ICB, and wider system partners. As part of the conditions of the Better Care Fund set by central government, this report was submitted to Better Care England on October 31st, 2024. And first of all, I'll just go through the metrics I mentioned. So this gives you a brief summary of how those performances were during that period, as well as some commentary into some of the things going on involving them as well. So if we look into avoidable admissions, we can kind of see we were on track to meet target, which is promising. And part of some of the work we're doing with that is with Newton, that there's a transformation program going ahead to help with further work. There were high admissions during the reported period, which did cause some pressures, but the system was resilient during that time. And what we're hoping for in the future is improved access to community schemes, which will further help reduce admissions. Because currently most people presenting to ED result in admissions rather than referrals to community services. And then if we move to the discharge to usual place of residence, also on track to meet target. This one's usually a strong performing metric of ours. And we usually think that to enhance collaborations between the health and social care teams, ensuring that timely hospital discharges where possible, and that there is strong capacity on the community home care framework, which support packages to be brokered, allowing recovering at home in alternative settings. We also have the equipment service that's funded by the Better Care Fund that is helping support rapid discharge. And then onto falls, which was not on track to meet target. This is one that we have got some challenges on, mainly focused around the high frailty levels in the BCP population. So falls are consistent year round with falls. So there's no peaks and troughs seasonally, for example. We do have community prevention services in place that are well utilised, but are inconsistent around BCP. And in the future ahead, Dorset Healthcare are exploring ways for community teams to identify high risk individuals to give them earlier support. And then residential admissions. So we have high, so services for independents at home are performing well and they have high utilisation, but the demand for residential care is still high. But we are trying to following the D2A practice, using services such as rapid response to facilitate discharge, where a person can be assessed in an environment that's familiar to them and reducing the risk of deconditioning. And we've also utilised in the disabled facilities grant to install housing adaptations for people. So in the reported period, 66 homes had those adaptations installed, and that's going to help people remain at home. And then within BCP Council, there's the Adult Social Care Transformation Programme that would change our approach to delivering long-term care, reducing the need for residential care placements using holistic alternative services that would provide fulfilled lives. Move on to capacity and demand. So an update to capacity and demand plans that were made in the original 24-25 plans was provided. So having help from ICB partners, I'll just sum up the headlines that were provided. So Pathway 1 discharges exceeded forecasts, with July being seen as a challenging month. Despite having the sufficient capacity for short-term home care and reablement, the higher demand led to some longer wait times than originally anticipated. There has been a reduction in length of stay, particularly in the longer stays, so such as 21 plus days in acute and community hospitals. And then they also requested a narrative for winter readiness to be provided with focus on improved utilisation of available capacity for discharge, while we continue work in simplifying the processes that will further reduce length of stay. Admission avoidance is integral to our winter readiness plan, so through utilisation of same-day emergency care and virtual wards, and continued partnership working with the voluntary community and social enterprise sector is also proving beneficial to helping us. And then this is just our expenditure to date. So we just provided details into all the schemes linked to the Better Care Fund, and this gives you an overall see of like how much was spent from April to September and what our balance is. So it's roughly about 50.07% was spent. So that would be in line within September because it's been 6 months since that originally kicked off. So that is a total of 75.5 million from the total Better Care Fund budget. And you can see the breakdown of each partner, so BCP Council spend and the NHS spend, and the balance that's still remaining. Most scheme expenditure is on track. One underspent scheme was identified, but reassurances that this will be back on track by the third quarter. And then I just wanted to provide some examples of the schemes that the Better Care Fund pays for. So just to go back to the Disabled Facilities Grant, that enables people to stay independent at home. And we have housing adaptations and our integrated community equipment service to help with that. We have intermediate care services to help people receive the best possible care outside of hospital. And we have vital NHS services such as palliative care and district nurses to provide care in the community. And we also continue funding with our voluntary community and social enterprise partners, as well as giving support to our unpaid carers via BCP carer support. And here's just some of the outputs, which is just an example of some, because in the report itself, it will have the outputs for all the schemes, which is over 50, but just gives you sort of an overview of the work that's ongoing using the Better Care Fund monies. And then just to wrap up, we're looking ahead with the Better Care Fund as we are approaching, well, we're currently reporting Q3. So that will be presented at the next Health and Wellbeing Board meeting on the 24th of March. Further ahead, the Better Care Fund England are developing a Power BI dashboard that is going to provide more comprehensive data that we can use along with partners ICB and Health to have greater insight and help us steer what we can do, continue using with the Better Care Fund. And some news with the Disabled Facilities Grant for 25-26 has recently been announced. So for BCP Council, that's been increased to £4.3 million, and that is a 13% increase from last year's Disabled Facilities Grant. The policy framework for the Better Care Fund 25-26 is expected from the Department of Health and Social Care shortly. Hopefully we'll have some news in the coming weeks for that. Other than that, that's me. Thank you.
Okay, thanks very much, Scott, for that run through, and thank you for the presentation as well. Because I know looking at the the tables of the Better Care Fund report is not the I say not the most accessible report, is it? So, any other comments or questions? I'll go Kieran first, and then.
Cheers, thank you. Yeah, I'd just like to echo the comments around the presentation. That was a lot better than reading the report, to be honest, and really helpful. The one question or query I had was just around the prevention of falls and the inconsistency across BCP. I just wondered what that inconsistency looks like and the reasons behind that inconsistency.
It's just the access to some of the services. So a quick example is that Christchurch will have classes that helps with preventing people having falls at home. While that's quite well utilised there, other parts of BCP won't have similar services. There'll be similar ones in particular like populated areas, but it's more out when you go outside those areas, it's when it gets inconsistent.
That's really helpful. So do we have any plans in place to try and make it more consistent, I guess, and try and make sure that there is that level across BCP?
When the conversations for the future Better Care Fund come in place, it will be mentioned then. But I don't have anything at the moment, unfortunately.
No, as long as it's on the radar, I guess.
I think Patricia was first, but earlier than me.
Shall I speak now?
Sorry, yeah, Patricia, if you'd like to come in.
So I think I've said this before. I find the Better Care Fund report really difficult, and it's not just for you, in Dorset Council area as well, because I still don't think we've got to a point. Put aside the whatever the governmental report needs to be. I still don't think we've got to a point in that report with describing a core set of issues that we're trying to address, what we're spending the money on, and if we're having the right outcome in terms of those issues. And so in the report today, as an example, it's fine to tell us that the falls and prevention services are well used, but actually what we need to know is, are they effective? Because lots of services can be well used, but it doesn't mean they're delivering the outcomes that we want. So I think we've got to get in some of that granular of tying the action to the outcome for the community, so we can start to see that significant investment that we're making together as health and local government college is actually having the impact that we want. If what we're saying is in this report is, for an example, is that falls services are not consistent, then we are contributing to health inequalities, and we need to find a way of making the right adjustments so that we're not, because we can't be fighting it on one end of the pendulum, on the other end find that we're contributing to it by the actions that we're making or taking, or the way that we are logistically organising our services. So I still think there's work for us to do in understanding whether we get true value for money out of the Better Care Fund investment, or whether we need to spend it in a different way. And as we move forward with the urgent and emergency care transformation work, and the integrated neighbourhood team work, we also need to be clear where these pieces of work connect and overlap with each other, to make sure that the Health and Wellbeing Board understand the full breadth of the transformation work that we're doing, and where they can expect outcomes to be delivered in different places depending on the investment that's being made.
Yeah, thanks for that. Useful points.
Oh no, so I was just going to add, I think, it'd be useful, obviously the next time I bring this to the Health and Wellbeing Board, is if I gather more information on those full services to present to everyone, just so we know better what's going on.
I think you could do that, but I think the bigger issue is that, so when in the report where we've got the highlights section, it's fine to tell us what activity is being delivered with the report, but activity doesn't tell us anything. It only tells us something if we then know what is the result of the impact on the communities from them accessing those services at that level. And the NHS is great at this as well. It will tell you we've treated 20,000 more people in a month in X. What it doesn't tell you whether those contacts have made a difference, a positive difference to people's lives. And that's the thing where I think we need to start to getting better at reporting that, so we know we're making an investment in one end, and the shift in the health and well-being of the communities is clearly being demonstrated by that investment.
Okay. Sam had indicated I'll have Sam first, if that's okay.
Yeah, thank you. I was going to make a kind of similar but related point. It's a bit about the timing, isn't it? So this is Q2. It's always retrospective, and yet we know what's been happening over the winter in terms of winter pressures. A lot of these conversations happen in lots of boards across the system, and it is quite hard to keep up sometimes. But what I was thinking about is, what role could the Health and Wellbeing Board play in championing maybe 3 key issues that we already know are coming out of the Q2 report, which it would be helpful to kind of track. I support what Patricia's saying about effectiveness. So I think I saw in the spreadsheet in the small print, Dorset Healthcare is saying they're interested in looking at more community interventions around falls. So we ought to track that as a board over the next few quarters to find out what it is they're planning to do, what's the scale going to be, what's the impact going to be, and Patricia's point, what's the experience of people that are receiving that service? Is it going to make a difference? I think the other one, just very quickly, that was in my mind was, I think there'll be a look back in the spring around how well we did as a system in terms of publicising some of the interventions like flu jabs, infection prevention and control in the community. We always get to this too late when the infections are already well rooted in the community. So there's something about what could the Health and Wellbeing Board do to help publicise some of that. And it wasn't easy this year because the eligibility criteria changed for over 65. So lots of people didn't routinely get their flu jab that they had been receiving as part of the COVID response. But I also know that I think take up of flu jabs was quite low in some high risk groups. So could we be more prepared? And then the Health and Wellbeing Board bit is, do we actually do some more public statements around this as a board? It's a question for the board.
Okay, thanks for those points, Sam. Betty.
Yes, thank you. I think there's several things really. I mean, I'd like to thank Scott because it's not an easy report to get your head around. You know, he touched on that there are 50 schemes or so. So it can be a bit of a minefield if you're not really used to this area. Totally echo what's been said by Sam and Patricia. I think for me, you know, we set the better care fund for 2 years. We know that we need to build in a review period within that. And I think that we're probably getting to the stage where we need to start to consider a review. And that review will be able to tell us, you know, what's our direction of travel? Have things changed? You know, I'm really keen that in the Better Care Fund that we really give carers the voice that they need. There's a big element of that is focused on carers as well, and I think sometimes we tend to forget that. I think the whole prevention thing could be grouped together into different ways of us being able to track it maybe in a more simplistic way. I would also say that when we submit our reports, we are often you know, for the Dorset system, we're often complimented on how much we've been able to put in it and to break it down. But I do think that we're probably at that stage, looking at prevention, looking at the stuff that we're doing within the future care programme, which is our UEC and the work that we've been doing with Newton. It's now called the Future Care Programme. So if you could start to try and refer to it as that would be brilliant. So that's our programme. There will be connections, very tangible connections with this. We have to make sure that we're not duplicating too much in too many spaces, and I think it might have been Sam said or Patricia that this comes up in so many spaces. The BCF is noted everywhere, and sometimes we just need to be careful because everybody wants a slice of it, but it's important to acknowledge what we're collectively signing up to. And it's a lot of money, but it's not a huge amount of money for what we're trying to do. So I would recommend that we begin to look at a review, that we begin to think about where are the connections with the future care programme, with other things that are going on. The falls point is a point that we've discussed and talked about many times. I don't think there's enough of anything in there to give me a sense of what that might mean and what that might say. And that's not a criticism on the report, because that's just telling us that we need to get into the weeds a bit more. But I think it's about looking at the overall preventative element of it. And also we need to look at the DFG element a bit more detailed. I think we could review the really core key areas and then produce something that I think we're able to then, as a Dorset system, be able to take forward and really understand the direction that we want the BCF. And David, just finally, we did some work with the LGA on our BCF programme when we had them in to do a piece of work, whenever we invited them in to do a piece of work with us. I think it's really helpful to also get a sense from a wider national perspective as well whenever we're doing that. If we're going to do it, let's do it right and let's do it thorough. Thank you.
Thanks for that, Betty. I did have Richard indicating next, if that's okay.
Thank you. It's yeah, a lot of the points made, I completely support them, and obviously it's a great example of joint working, so absolutely commend that. And then the comments are really about how even better if. So I think the bit about aligning with the future care programme, absolutely. Probably about whether the targets are stretching enough, and I suppose particularly I know falls is well debated, but it doesn't come across that collectively with BCP are significant outliers on falls leading to harm. So that's got to be something we look at. And I would say that there's really good practice in the wider Dorset, and that's particularly about not statutory interventions, and absolutely Patricia's point about what's effective rather than just commissioning more widgets or assessments, because I think particularly I think the North Dorset example, where they've really made lots of progress, is about taking non-statutory routes. So I do think there is that bit about how do we get the future care programme stretched, because we know there's big opportunity in falls and in mission avoidance. So I think aligning, you're absolutely, so it's really echoing and supporting Betty's point. The other point is slight implied comment, but seasonality and spend patterns that aren't just flat and exactly split half year is fine. I think we'd almost recommend that there was variation and targeted work. And then I think finally the only area that we're not picking up, and again might be others a better place to say, but is clearly the number of no criteria to reside patients. It is a factor, and whether Better Care Fund or other means, and again there are lots of other panels looking at that, but again just making sure we're leveraging this opportunity for joint working. So that would be the only area that maybe when it comes to review time just to consider as well. But overall, obviously support, and again thank you for the presentation.
Sina, did you want to come?
Yeah, that's okay. Thank you. Just to note, the actual annual report is due in May, so that's where you'll see that granular detail. And this is just basically a flavour of the metrics, really, the additional narrative that Scott's pulled together with our health colleagues, and that granular detail. And also not dismissing that detail does need to be shown, is generally shown in the actual annual report.
Okay.
Thank you.
Thanks. Kathy.
Yes, thank you. It does feel like, as Betty, you kind of said, it feels like a large pot of money, but in actual fact, when you think about it and how it has to be spread across a really, really wide system, I would agree and would want to think about some of the comments that had already been made about, are we targeting the right people or are we sufficing the many? But in actual fact, what difference is it making? And obviously there are particular priorities along that, and so I would welcome that annual report to see that granularity. But I guess for me, and you would get this from me, 18 to 25-year-olds, we talk, where in terms of that for our SEND, neurodiverse, all of those children, when they're not children, adults at that earlier end, especially in terms of that prevention, especially in terms of that support, where are they in this scenario? And so are there kind of any pathways or thinking around that, or is it particularly for older people? And so I just want to pose that question. So I'd be interested to see if they get covered in the annual report.
Any other comments or questions? Scott, did you want to?
Oh, yeah, sorry, I just wanted to go on that point. I think with targeting, like when it comes to the age groups, there are certain schemes in there that will sort of catch all within that. So I'd look at sort of the unpaid carers that we support. You are going to get, carers of all ages that we are supporting. But yeah, so we've got schemes like that. We also got the Swan advocacy that we support as well through one of our schemes. Yeah, so there are things, we obviously, as we approach 24, 25, there'll be, 25, 26, there's further conversations that we could be having. But yeah, that is how we currently stand.
Kathy?
Yeah, that would be really interesting to see. And I think there is a bit for me to do is look at those young adults that we support and whether they are actually being supported within this scenario and what that looks like, especially in terms of being at home, hospital discharge, etc., EHCPs, all of that. I would be interested to see if there's the granular detail about those children, those young adults.
Right. There's a lot of useful comments there, actually, and I sort of don't want to lose actually that useful sort of consideration and input there. And I take Zina's point about the annual report. We'll have in May or whenever it is, we'll have the sort of the detail. And I think, Scott, you've probably got a few indications there about certainly the focus on different groups, different age groups, but also I guess the focus on not what activities have been delivered, that's important, but the impact that that's actually had, and how, you know, how the value for money point that Patricia and others have sort of raised, and the impact of the Better Care Fund. Like you say, it's £75 million in a year is a lot of money, but then when it's split across 50 schemes, and a few of those that you've mentioned, you think, oh yeah, that's right, there's a couple of million going in there, or there's hundreds of thousands going in there. You know, it sort of does make you realise actually that there's, when you cut it down, there's an awful lot in there to report on. I'm just trying to think whether the recommendation before us is that the Health and Wellbeing Board retrospectively approved the Better Care Fund Q2 report. I think we're happy to do that, because I haven't heard anybody sort of saying, actually, I'd like to challenge this this point in the report or anything. But it's whether we have another recommendation or anything additional to that, just to try and capture some of the points that we've made there in terms of a review, and whether that's in sort of line with the annual report, that we sort of start to review and seriously think about the impact and what we can do as a Health and Wellbeing Board to actually hold the Better Care Fund to account. You know, that actually this money has been pumped in by the council and the NHS and different funding sources, that how we can make sure that we are getting that value for money, and it is actually having a result which is impacting people's lives positively. Gillian, did you want to?
To come in on that point, Chair, I agree that we should be looking to review it ahead of the 25-26 schemes, which means we need to start looking at that now, and I know that will be in Scott's and Zina's mind already to do that. I don't think we can wait until after the annual report has come in May to say what are we going to be doing from next year. So it's almost starting to set the parameters for that now. And the timing of that's good. The future care work is ongoing. It's very, very data-led. That will help inform some of the thinking as well of work on. So just to support that, but I think it's something that we need to start now, as and when we've got the next iteration of the government guidance, which we're expecting any time now as the starting point for that look ahead to next year.
And I'm just conscious, do we have the resources that we need, do you think, in terms of officer time? I guess really it is that in terms of doing a sort of proper and full review of that. But Betty, did you want to?
So I would suggest that we do the review, because I think we need to really understand where it is that we think there might be duplication, or what areas need a bit more focus. I think for me, I would be recommending that the review is led by Sina, or someone like Sina, bringing in Scott and her peer in our ICB, because it's a joint piece of work, and it's got joint oversight, and we will have our colleagues in the ICB who are equally as cited and equally as involved in it, and in the review and in the submission of all of the performance. So I would suggest, yes, we probably do need to review. Let's see what the policy framework says any day now, if there's any changes to that, and then plan that piece of work in. But it would be a joint piece of work that we would do across health and social care.
Yeah.
Thank you.
Would it be reasonable, do you think, if I just a simple recommendation, I guess, that the Health and Wellbeing Board request that plans are commenced on a review of the effectiveness of the Better Care Fund in consultation with our partners, and maybe a brief update. Our next meeting is 24th of March, so ask for a sort of brief update on that at our next meeting in March. Does that sound? People are nodding. Does that hopefully capture the sort of the sense of the points that people were raising? Because I don't want to lose that. Just say, oh yeah, okay, we'll approve the Better Care Fund report. Let's move on. When's our next meeting? But okay, thank you for that input, and I think that's a useful recommendation if everybody's okay with that, and if we manage to capture that, Sinead. Thank you very much. Okay, good. Thank you very much, Scott, for that presentation, and for actually bringing a little bit of useful information to what's often a sort of really difficult, detailed report to consider. So, great. Agenda item 9, Health and Wellbeing Strategy Update. Sam, you've been doing some work over recent weeks on this.
Yeah,
Thanks for that. So I'll let you update us.
Thank you very much, Chair. And I'm really only presenting on behalf of the team because, not least, Natasha and colleagues have put quite a lot of time into this survey. So I was just going to share my screen and I'll present the findings briefly. Bear with me a second. It's not that. Hopefully you should be able to see that in full screen in a minute. It's not gone, has it? Is this system a bit slow? There you go. So just a reminder as to where this work started. It seems like a long time ago, but we had a development session for the Health and Wellbeing Board to consider this question of what do we do about refreshing the strategy. Just by way of background, we had the Integrated Care Partnership Strategy published, and then the question was, how do we start to think about refreshing both Health and Wellbeing Board strategies, obviously one in BCP Council and one in Dorset Council, to take note of some of the direction of travel that was set by the Integrated Care Partnership Strategy. And we had a really helpful workshop, which I think was called From Strategy to Action, where we got a very strong steer that we didn't just want to invest a lot of time in writing something. What we really wanted to do is to pick up the areas where we wanted to see delivery. So going a bit further than just setting out priorities. And then partly because the council was going through developing a new vision and a new council plan with a new administration, we sort of paused to wait for that to settle. And in the intervening period, from a separate discussion with the board and also the place-based partnership in October, which had its first meeting, we agreed to do a bit of engagement work with board members rather than officers writing something and then consulting on it. Develop a survey that was going to ask some key questions of board members and then present the findings back to the board. So without further ado, these are the results of the survey. And as I say, thanks in huge part to Natasha, who pulled this together and did the administration of it. So we had 11 responses in all by the close of the survey, which is, well, I've been kicked out of the meeting. Never mind. Let's try and share again. I'll just try and get back into the Teams meeting. I tell you, we're all on the edge of your seats.
I say last meeting the technology played us up a bit, didn't it? But it all sort of froze for a while.
I think it might be GovRoam, which is the network I'm on. Right, so here we go again. So we had 11 responses, and we sort of just took the decision to close the survey before Christmas, just so that we could have the time to come back to the board and then we can actually move it on. So these are the kind of findings. The first question we asked was, in your view, as a board member, which theme should be used to structure the health and wellbeing strategy for BCP? And it was really a binary choice between keeping the themes from the previous health and wellbeing board strategy or starting to align with the integrated care partnership themes. And I think there's fairly strong support for coming in line with the integrated care partnership, which I think is really helpful. They are very broad. There's lots of scope and there's lots of room for more detailed priorities within them. On the right hand side, you can see an example of some of the issues that were mentioned by board members and a sense of priority there. Children and young people emerged very strongly from the board members that were surveyed, as did the current work on community mental health transformation. So this is this idea that we're moving from services which have generally looked after people perhaps in more secondary care type settings and trying to move more resources into community services and to support people at a much earlier stage. Also, the theme about supporting adults to live well and independently, there's a really strong connection there to the Better Care Fund and what we might be trying to do through some of the programmes, Future Care, for example. Housing, unsurprisingly, came up. Cost of living and poverty, no surprises there. I'm really pleased that people mentioned physical activity, because you remember the Health and Wellbeing Board has received the physical activity strategy on a couple of occasions and is a champion of that strategy. A bit less love for working with integrated neighbourhood teams, but that might become stronger as the work progresses and it becomes a bit clearer, the Health and Wellbeing Board's role in championing that programme. And then also mentioned the development of other community assets like family hubs, so good to see that on there. And I was slightly disappointed as Director of Public Health to see that going smoke-free by 2030, which is probably the biggest public health advance in a generation, came last in the list. But I'm not gonna carry it with me. Don't worry, we're making really good progress on it. So maybe that's why board members put it low down the list.
I think they're confident it will be delivered anyway. So it's sort of, in terms of the importance, it was less important.
So I think this next slide is one of the more helpful ones, or at least it appeared to me as one of the more helpful ones. So this is what were the kind of general themes or the principles coming out of those responses. Really important to understand the Health and Wellbeing Board's remit. So we've had conversations from time to time about, what's the difference between scrutiny, Health and Wellbeing Board. We're not short of strategic boards, plans, places where we talk about some of this stuff. So what in particular is the Health and Wellbeing Board going to champion? I think that's a really important question. Identify some of those areas and then line the board up and support board members up to champion those and to understand what the board can do to perhaps push progress on and remove some of those barriers. People also talked about the opportunity to convene some of the system partners to share their work programmes in relation to health and wellbeing, and perhaps the board, again, is that champion role in understanding what might be possible. Interestingly, bullet point 4 starts to talk about this inclusion of health and wellbeing issues in all policies. Anyone who's read the devolution white paper will see government's made a statement on that for strategic authorities about starting to consider a health in all policies approach. It's a question about the alignment, I think, here with the council plan, and what does BCP Council want to do to really push on some of those priorities. There's some strong statements made in that vision. So what role can the Health and Wellbeing Board play in delivering that? We've had the presentation earlier today about looking at relevant data and making sure that we've got a really good JSNA, but also a way of monitoring progress, going back to Patricia's point, what difference are we making? And then focus on working together in co-production. Could the board act as a bridge between strategies? We're not short on these plans, but how do we try to get better alignment, better consistency, and do fewer things really, really well? And then the final one I think is going to be really important is to make sure there's that really strong connection with the place-based partnership, which I think covers more like a bit like the delivery board of the Health and Wellbeing Board, if you like. And as integrated neighbourhood teams develop, I'm sure it will be important for the board to continue to follow some of that progress. So just a bit more detail on some of those priorities that were mentioned. I'm not going to go through this in a huge amount of detail. You've had the slides in your pack. A bit more on community mental health when the slide moves on. And there's further detail in the presentation on what people said around housing and supporting adults to live well. So I'll probably pause there. One of the other comments I guess I'd make is it's quite interesting to see what's not captured there. And I guess the board has an opportunity through workshops, through development sessions to kind of do another round of engagement really. If I think back to the BCP Council plan, there was quite a strong statement about the importance of place shaping and the importance of health through things that you can do to make the environment better, whether it's better quality housing, whether it's better quality green space, blue space. What's missing from this might be a broader view of how the Health and Wellbeing Board supports that council plan vision. So it would be interesting to see if we can pick up some views from board members as to whether is there a risk it will become too narrowly focused on health and care, or do you want to pick up some of the wider environmental issues? But happy to take questions. I think for me, Chair, one of the conversations that will be really helpful is where do we go next with this? What would the board like to see in terms of getting that strategy actually developed and live? So happy to take questions.
Okay. Thank you. Yeah. Any questions for Sam on the... Oh, Patricia, you've come in. Do you want to go first? Yeah.
Thanks, Sam. I was thinking about when I was involved in the Patricia Hewitt review, and one of the recommendations was that government departments tried to work more closely together to make sure that good health and well-being, because it touches everyone and is intimately connected to thriving communities and economic growth, whether that should be the golden thread that ran through all government decision making. And when I look at not just the 2 local authority council plans, and what was going through my mind is, how do we reposition the health and wellbeing boards and their strategies as being a really important foundation to good decision making for local government overall, because of that connection to, what the local government reorganisation is going to look like, what they're going to be expecting combined authorities and Metro Mayors to deliver, and that connection between good health, as I said, and economic growth and thriving communities. And so how do we raise that profile of whatever we decide as the Health and Wellbeing Board strategy objectives, so that through local decision making of public service, and that includes health, that we're making sure that if in these challenged times going forward, we're about to make decisions that could have significant impacts on community health and wellbeing, that we're understanding what those impacts are, and we're also talking about what the mitigation of them might be once we've decided on what those priorities should be within this strategy going forward.
Yeah, thanks for that. I don't know, Sam, if you want to comment on that.
No, I agree. I've felt for a long time that we don't make enough use of the Health and Wellbeing Board as a statutory subcommittee of the council. And I think the current Minister for Public Health is very keen to see stronger health and wellbeing boards. So it's an interesting time. And I guess I'd say don't lose the opportunity of using the board to really affect something very, very powerful. Sometimes it feels as if you just leave it to a few people in public health and the NHS and perhaps colleagues and adults and children to put some ideas into the strategy, you've kind of missed a bit of a trick, I think. It should be the place where we are championing the things that need to change if we're really going to improve population health and wellbeing.
Okay. Any other points or comments, Betty?
Yeah, I would absolutely echo that. I think we could have a much more stronger influence and role as a board, and have a bit more clarity maybe on certain things. I do, Sam, just looking at what you'd sent, and just come back to the summary. I mean, do we feel that number of responses is that? I mean, that seems really low. And I just wondered what was, how does that compare to other kind of, responses received from a survey, this type of survey? And if it is lower than what we would have expected, how are we making sure that people are aware of that, and then that we're engaging and that we're getting the influence that we need? Thanks.
I'll just come back on that. To be honest, I think it's about par for the course, Betty. So it was sent out to current board members and former board members. We took the decision not to keep sending it out. I think it's not scientific, but it was, the purpose of it was more to try to engage board members rather than draft something, send it out, and perhaps have a weaker consultation around it. I think there's still opportunity to take this information for the board to put it into a draft strategy format and for it to go out again, and to say, does this look right based on, and we might even resend the survey questions just to prompt people. But I think it's about par for the course.
Okay. Richard, do you want to go?
Yeah, I mean, first of all, coming back on that, first thing I did is had a look at the email because I thought 11 doesn't seem very much, and I thought, did I do the survey?
Yeah.
And then I looked back and there's a red flag next to it, which suggested I was going to do it, but I never did. But I'm really pleased in that case how children and young people came up. So we
Suggest you might have done that.
so it's what
Kathy
I'm
did
thinking.
4, so just to make up for the.
Following on with what we're just discussing as well, the support and inclusion of health and well-being issues in all policies is something which I was focusing on here, and that's what we've been talking about, because I don't think we do we? No. I'm talking about general local authority policies. I mean, I'm just taking one thing, which the active transport issues. We never seem to get the health and well-being perspective of active transport. It's always looked at from the lens of always trying to get people cycling, and because it's all those people, and that's a debate that happens in the press, isn't it? But it never happens. Yes, but if more people to do this, it would actually make our population healthier and actually save us money as well, because we have a healthy population. And the same with things like planning and licensing and that sort of thing. That therefore, I'm really, myself, I think, looking at health and well-being in our wider policies, I think is really important, particularly with your children and young people.
And
adults. Kieran, you indicated as well.
Yeah, again, just on a similar vein to Richard, Councillor Burton, just the fact that housing has been highlighted is really a positive thing. I think it's so fundamental to health and well-being. I always harp on about it, but when back in 1919, when the Allison Act came in around council housing, it was the health minister, Christopher Addison, who was pushing that, because it was seen as something that you couldn't have a population with good health without having good housing. And I think if you look around the world, the best examples, the happiest, most healthy countries are ones who have got a grip on the housing situation and treat it as a right as opposed to a commodity. And so I think there's a national part to that, but locally we also need to be doing more. I think one of the reasons why housing went under the Health and Wellbeing Directorate originally was to try and be more cohesive and to reap the benefits and to understand, to try and link in better with health. And I'm not sure we fully currently achieve that. I think we're definitely conscious of it, and we want to see it go further, but I don't think we've reaped the rewards of that merger. So it is really good to see this being highlighted, and that's despite children's trying to wait it. So really, really positive.
Gillian.
Yeah, thank you, Chair. Just in response to the comment there, of course, children live in houses too, and in homes too, and families live in homes, and that's the connection, isn't it? And I agree, it's really important, and I'm glad to see it up there. But I wanted to connect us back to the conversation we had around the Better Care Fund, because I think what we're grappling for as a board is a sense of what it all adds up to. And what I take from the really helpful summary here is just how much is going on in our system, and I mean our system in its broadest sense, not the narrow health and care system, but the system that we are at the heart of as a health and wellbeing board. And we have a huge number of different levers that we can pull as a board at its fullest with all the partners around the table, but knowing a sense of what things are changing, what impact they're having, and what that means we should focus on next, I think is what we need to try to bring to the board so that it can have the greatest impact. I think when we had that development session and we talked about strategy into action, that's what I took from it. It's that sense of having a direction, steering things overall, but and changing our course where we need to, and changing the interventions we make. We do have a plan. We're going to go out shortly with dates for the next date for a place-based partnership, more of a workshop session, and what we wanted to do was to take the steers from this board into that session, and it's a kind of iterative process, isn't it, going through. But I think this gives us a good sense of what the high level priority areas ought to be. But what we need to try to do as we're going forward is give ourselves that sense of what all these changes are adding up to, what difference we're making, and therefore where we should put our future attentions most to make the difference that we want to make across BCP.
Any other comments or additions to Sandra?
Yeah, I think it was touched on just now, would be the input into licensing. We have an absolutely thriving nighttime economy in Bournemouth, not so much in Poole, Christchurch, but definitely in Bournemouth. But often we look at things through all sorts of lenses, but very seldom through health and well-being, and there's very seldom any sort of input from public health, and I think that might be interesting in the future. Dare I say that it could change things, or at least we would be able to look at it. But I think there's a whole new world of opening up with that sort of lens. That's just my thoughts. Thanks.
As long as you're not suggesting that as
I don't want to be
chair of the Health and Wellbeing Board,
killjoy or anything.
I should attend every planning committee meeting and every licensing committee meeting from henceforth. Don't know if I'd be able to commit to that. Might be interesting. I attend quite a few anyway. Okay, yeah. Thanks, Sam, for pulling those thoughts together and that survey and the responses there. I think it was interesting to see the spread of the responses across those different areas. Which probably say wasn't quite what personally I'd have expected. When you look at it, it sort of came out a bit different to what I thought in a couple of areas. So just in terms of taking this forward, in terms of the Health and Wellbeing Board strategy, and drafting a strategy. So you said there's, I think probably in terms of getting responses from the sort of wider board is probably have that sort of draft strategy to say, well, okay, this is what you've told us, this is what we're thinking, what would you want to sort of reprioritise, deprioritise, change around, that sort of thing. I don't know if anybody else has got any thoughts in terms of the sort of next steps on the strategy, whether we'd like to sort of have a draft version to go around to board members to give their feedback on. Does that sound? It's a difficult one because there's so much within health and wellbeing that I don't want that sort of draft strategy to be this is everything we could possibly do, when what we've all said already is we want action, we want to see things that sort of focus delivery, because we can't deliver everything that everybody would ever want. So I suppose I'm envisioning a sort of I think, like we've said before, a light touch strategy, but maybe with those particular priorities, whether it be from the council vision and the things strategies that have already been set, and from the I think you've got the go ahead there for sort of using the integrated care partnership strategy themes as the structure. That's a sort of fairly clear indication to actually then focus us down in terms of delivering some actions in those particular sort of ICP strategy areas and in line with our council vision. I don't know if does that sound Okay, yeah, to come to our future meeting, whether that be what we scheduled for May and for March, and then is it May, June? I think the next one. Any other thoughts on that? Because we haven't got a recommendation in front of us for this one, but do we recommend that, following up from the survey, that a draft survey paper be presented to future board meeting, along with potentially, and sent out to board members the draft survey, and the survey again, to send to board members to encourage more feedback. Okay. Okay. That sounds all right then. Everybody's nodding. Good. Okay. Well, we'll go with that. The next agenda item is the forward plan. So I think all I need to say on this one, we've got obviously the Community Action Network presentation has been deferred from today to go on to, so that'll go on to the next meeting on the 24th of March. We've already got on for the 24th of March the Better Care Fund Q3 return. So that'll be another update from Scott for Q3. Should we ask for the draft strategy to be at the March meeting? Does that? I don't know. You've got other priorities in terms of.
Yeah, I mean, maybe just we need to talk about that a little bit, because we have got a lot of disaggregation work to get through. Just as an idea, I wonder if there are some volunteers that might come together to do a bit of a planning meeting around this. Okay. I reckon in 2 to 3 hours, a number of people could probably scope this, but it would need to be focused on actually getting the work done in the room at the time.
Yeah.
And I'd strongly recommend picking up on some of those themes that I've heard today around the table about what is the BCP Council position on moving towards a health in all policies type approach, because it would pick up the issues you mentioned around licensing. It's a really interesting idea, as well as Patricia's point. It's an interesting point in time, isn't it? So I think I wouldn't want to necessarily be responsible for delivering it, because I'm not sure I'm going to be able to, but I can certainly get a group going to look at this and continue the work, if that would be okay for the board.
I think so, and I think you're right that at the point in time as well, because there's national sort of statements and policies coming out influencing this, it makes a little bit. We don't want to come up with something and then we realise it's out of step with the sort of national agenda. We want to make sure it's sort of is in tune with that national agenda. No real reason to think that it wouldn't be from what we've heard so far, but we want to make sure that we can sort of align it with the national agenda. I think probably a sort of planning meeting like you suggest, where actually it can be drafted in the meeting, and at the end of a few hours we've got, okay, that's ready, we can send that out to people. I think that's probably a good way of doing it, actually, rather than via email and sending it around and then asking one person to sort of tie it all together. Does that sound okay? Gillian, did you want to?
Yes, absolutely, and absolutely to Sam's point, this is not something for public health to take away and do for us. No. This is something for us to do together, because that's the only way that it will drive the sort of system action that we need. One thing I just wanted to observe about the meeting today, we've unfortunately Karen from Community Action Network was not able to join us, and we did have Louise Bate with us, but she's had to drop off, so we are lacking any, unless I've missed someone, representatives from our voluntary and community sector. Yeah. And I think it's really important that all of this work is not just within the council and the NHS, but it's a much broader collaboration. And so I just wanted to note that was the case for this discussion, and we will need to and want to engage really fully with our voluntary community sector partners as well on this.
Thanks. Patricia, you wanted to comment?
Thank you. I was just thinking, Sam, that we were due to meet this Friday, weren't we, as a health and care and third sector colleagues around the partnership and what programmes we need to deliver in 25-26. Given that we're not doing that now until March, it would make sense that if we're going to come up with a set of priorities for the Health and Wellbeing Board strategy, and we're about to do a brief refresh of the integrated care strategy and the joint forward plan, that we try and make all those pieces of work joined up together so that we are sensitive to local priorities, but also working on a small number of transformation or health improvement programmes across the entire Dorset integrated care system.
Okay, thanks for that. That's a useful addition. So yeah, I think Kathy, did you want to?
Thank you. And I think within that, there's consideration for the Children and Young People's Partnership Plan, because again, that will give clear priorities in terms of determining health because it is a joint partnership. So again, that could be quite easily incorporated within this.
Yeah. So I think you're right. There's an essential group of people that we do need to be in the room to make sure that all bases are covered, whether it be children and people, whether it be voluntary sector, to make sure that we have all those sorts of that input and all those voices sort of heard when it's being pulled together. Yeah. Okay.
I'm just wondering the expectations of that group into determining that as a group, and whether there is a need for somebody to be pulling together some of the elements of all those plans to develop it. So there is a kind of shaper within that, because I can give people the Children and Young People's Partnership Plan, and elements of that can be taken and reviewed across a system where other plans are aligned, which could come up. So I'm just questioning what the group meet. What's the expectation of that group? It isn't a planning to plan.
Yeah. But there's so many cross-cutting plans, isn't there, that you want to make sure you don't sort of you're not aligned with.
So I suppose what I'm thinking, when I was thinking that Children and Young People's Partnership Plan, we had some support to drive the elements across a partnership to develop those concepts within one plan. And so somebody enabled us to take that big funnel and take it down to a small number of pieces. And it's whether there's needs to be someone who is tasked within the system with those skills to enable us to do that. My concern would be we meet, I talk about the Children and Young People's Programme, and nothing comes from that group. I think we need some support to enable that to happen.
A sort of facilitation support to actually
Or somebody to do some background work to bring those pieces together and to then meet the group and talk about the commonalities across the system.
Yeah. Okay. Do we know anybody?
I know people in BCP Council, but it's not for me. They're not my team. So, but I think maybe that's an outside conversation about who within everybody's system could be really supportive to enable that to happen.
Okay. So yeah, I think that's probably a conversation that we need to have outside to sort of actually work out how we put together that planning meeting and who's there and how we actually approach it to make sure that we get the right sort of drafted points. Okay. Thanks for that. So yeah, that will be on the work plan for the future, not necessarily on the 24th of March, but yeah, we need to have some thinking about how we sort of work that one through. Other than that, is there any other items for sort of future work, for future meetings, Betty?
I was just reflecting on our conversation earlier this morning. Whenever you suggested that you might want to bring something here around the updates or information or a briefing note or something of some context from the Urgent Emergency Care Board, and that might be something that you want to think about, or what the board want to think about. Whether David is the chair and I'm the vice chair for the UEC board. It might be something that you want to think about planning in, for a future meeting, and maybe we could have a conversation around what context that might be formulated around.
Yeah. Yeah, and that's not. So that's about urgent and emergency care, not about our future care programme. No, but about urgent and emergency care, and obviously because there's current extreme pressures nationally, but also locally on our sort of urgent emergency care system. And a bit of I think it was a look and review, possibly a bit of a wash up from winter pressures. But I'm aware that rather than us as a health and wellbeing board doing that, there are others within the system who are going to be working on that and doing that anyway. That we actually ask for something to come before the health and wellbeing board so that we can sort of make sure plans are put in place, whether it's lessons being learned or whether it's actually just making sure that the system is doing whatever it can to sort of to improve that.
And that might feed in to some of the stuff that Richard touched on around not meeting the criteria to reside. And also I know we have our chair of health and social care of fluid scrutiny, because we that particular board also look at the winter plan. What's the system winter plan and stuff? So it could be a briefing note, it could be a bit of a presentation, it could be whatever the board would want it to be. But I think given where we're at and how many systems have, declared critical incidents and all of that kind of stuff, might just be helpful for the board to oversee, because it does come to some of the other boards, but not to reinvent the wheel.
Yeah.
Because the work's already happening elsewhere.
Yeah, not to sort of ask officers to do their own separate piece of work, but actually to make sure that we're cited on the pieces of work that are being done within the system, that we're sort of satisfied that they are sort of asking the right questions and gathering the right intelligence to. Yeah, that's good. Kieran, did you want to? And then...
I don't know if Kathy was. Okay. Yeah, it was just Kat McMillan, who's listening online. She gave me a message and has offered to come to a future meeting to talk about the work of the Community Safety Partnership in relation to health. I don't know if that's something the board would want, but I said I would put it out there and offer, kind of thing, which is a very kind offer of Kat. So yeah,
I think actually, that might certainly by the next meeting we've got the Community Action Network's sort of presentation, but so Community Safety Partnership could potentially sort of it's fitting nicely with that as well. Actually, yeah. Okay, Kat, that's a good offer. Actually, something that we can slot in with in the next couple of meetings. Certainly, I think so. Richard, you indicated you wanted to, or Kathy first.
I've spoken about it a couple of times. I'm just wondering whether you want the Children and Young People's Partnership Plan here towards probably May. If it's launched in April, maybe later on.
Right. Okay.
On the forward plan.
Okay, we'll put that on the work plan to. Okay. Richard.
Thanks. You're having a flood of items now. I was going to add the one that is on the future forward, which is the changing role of hospitals. And given that we've got maternity moving in April the 2nd, and then the wider changes sort of this time next year for emergency care, whether a briefing at some point would be welcome, and either this forum or wider council briefing, whatever works best, really.
Yeah, I think that's a really important one to have. Partly for the health and wellbeing board partners to be fully aware and updated on things, but probably also for public information, isn't it? That it can sort of potentially sort of be communicated more widely that this is, this is what's happening this year, because I think there's an awful lot of. I think we've probably had the conversation of everybody knew about the clinical services review whenever it was 4 or 5 years ago, and there was a lot of heat, a lot of sort of debate, and then decisions were made, and it's sort of been quiet for some time. While all those decisions are being implemented and they're about to come to fruition, and some people are starting to sort of, you hear comments about things and about the hospitals and things, and it's all of a sudden. Certainly, I've heard questions, and recently, and I've thought, where were you 5 years ago when this debate was happening? Did you not? Yeah. Now that we're getting to the sort of delivery phase of it. Okay, yeah. So definitely, I think that needs to be sort of prioritised in sort of earlier meetings. So, yeah, that's a good point. Okay. if there's no other points for the work plan, I did want to say, Sam, I don't know whether this is your last meeting with the BCP Health. Technically, because just to make clear, Sam, you are still the Director of Public Health covering the BCP area as the Dorset Director of Public Health until the 1st of April. So even at the next meeting, you'll still be our statutory Director of Public Health. So I don't know whether you'll make the next meeting, but just wanted to sort of record my thanks and our thanks, I think, for your input, not just at board meetings, but actually in terms of the strategy development, the workshops, the papers you've prepared, and your team have worked on, probably more than most in terms of support of the whole Health and Wellbeing Board. I don't mean that as any offence to anybody else that comes along to Health and Wellbeing Board, but certainly yours. I've certainly appreciated your sort of comments and support in meetings and outside of the meetings. So thank you for that. I'm sure we'll still be in contact and still seeing you as in your sort of new role post the 1st of April anyway. So thank you for that. And I think if that's everything, then I can close the meeting, and we can all we've all gained 10 minutes in our diary. So thanks very much.